Welcome to the deep dive. So today we're plunging into something pretty much everyone has either experienced or seen, in those viral videos.
Oh, yeah.
That really bizarre kind of disorienting feeling of being anesthetized.
Yeah.
1 minute you're there, totally present, and then bang, it's like a switch flips.
An off switch, yeah.
Exactly. No pain, no memory, no consciousness. And then you wake up and it feels like literally a second passed, even if the waking up part can be pretty funny to watch later.
It really can be. Those post-anesthesia moments, there's something else. But,
Uh-huh.
beyond the last, there's this huge question, isn't there? How
Yeah.
can medicine just turn us off like that
Right.
and then turn us back on again? How does anesthesia actually work inside us? And maybe the bigger question for many people, how safe is it, really?
That's exactly the mystery we're getting into today. Our mission, well, it's to explore the pretty incredible science behind it all. We're going to pull out the key insights, what anesthesia actually is, how the different kinds work, and really crucially, what you need to know about preparing for it and about safety.
Cutting through the jargon.
Yeah, exactly. Giving you a real shortcut to understanding this, frankly, vital medical tool. So, okay, let's peel back the layers. To start, what is anesthesia? Like at its absolute core?
Well, at its core, anesthesia is basically any substance that blocks our sensitivity to things. It makes us stop feeling, at least for a while.
Okay.
Which makes them incredibly valuable tools, mainly because they remove our ability to feel pain. And that's why they're just indispensable for surgery, or really any procedure that would be, frankly, unimaginable without them.
Right, like anything from getting a tooth pulled.
Exactly. From a simple tooth extraction all the way up to, complex open heart surgery.
So it's like hitting a temporary mute button on pain, gives doctors a safe window to work, but I'm guessing it's probably more complicated than just one single off switch for everything.
Oh, absolutely. You're spot on. It's much more nuanced. Depending on what part of the body needs to be, put to sleep, we usually talk about three main types.
Three main types, okay.
Yeah, each with its own sort of scope. First, you've got local anesthesia. Like the name says, it affects just a tiny, very specific part of the body.
Like at the dentist.
Exactly.
Yeah.
That shot you get to numb your mouth for a filling, that's local anesthesia right there.
Okay, so super precise, small area. What if you need to cover, a bit more territory?
Right. So the next step up is regional anesthesia. This blocks pain signals in a much larger area. Think like a whole arm or a leg, or maybe the entire lower half of your body. A really common example, the epidural, often used during childbirth. It blocks pain from the waist down, but the mother stays completely awake and aware.
Right. So local for a spot, regional for a zone, and then there's the big one, the one that really feels like that total off switch we mentioned at the start.
Indeed. That's general anesthesia. This is the one that's like hitting that complete whole body off button. These drugs induce a really controlled state, sort of like a very deep sleep. The whole body disconnects, consciousness is completely lost. They're typically used for longer surgeries or very invasive ones, where it's just better for the patient to be totally unaware and completely still.
Okay, so we've got the feeling, the different kinds of off, but the real the core of this deep dive is how. How do these drugs actually manage to silence the body's alarm system, the pain signals? Because I imagine it depends on the type.
It absolutely depends on the type. And, to really get how they work, we need to think for just a second about that alarm system itself. Our bodies have this incredible life-saving pain response.
Right.
It uses these specialized sensors called nociceptors. Think of them as tiny warning bells scattered everywhere.
Nociceptor.
Okay, yeah. So when a nociceptor detects something harmful, like a cut, it kicks off an electrical nerve impulse. The signal jumps from nerve cell to nerve cell, traveling up towards your central nervous system, your spinal cord and brain.
Got it.
Once it gets there, the brain processes it, figures out what's going on, and creates a response. Which, is often an uncomfortable feeling, but pain serves a really vital function, protecting us.
So it's essential for survival.
Yeah.
But sometimes, like during surgery, that same pain signal is just too much. It becomes the problem itself.
Exactly. It's counterproductive, unbearable. And that's where anesthesia comes in. So how do these anesthetics actually block that essential alarm?
Yeah, how? Starting with local.
Well, like you said, it varies. Let's start with local anesthesia because it gives maybe the clearest picture of the blocking idea. Local anesthetics work by blocking the transmission of that painful impulse. Imagine those nociceptors, the pain sensors, like tiny microphones listening for trouble. But for the microphone to actually broadcast the pain signal, it needs these little on switches in its membrane. They're called sodium channels.
Sodium channels, right.
Local anesthetics, they don't just turn down the volume, they actually jam those switches shut. So even if there is a painful event, the signal can't even get started. It can't leave the first nerve cell to reach others, and definitely can't reach the brain.
Ah, okay. So it's like trying to send a text, but your phone has 0 bars, no Wi-Fi. The message just sits there, it never goes out.
That's a perfect analogy. Exactly. That's why we say local anesthetics block pain indirectly. They don't stop the injury itself, but they stop us from knowing about it.
Makes sense.
But importantly, it's not permanent. They bind to those sodium channels reversibly. Eventually, they let go, the channels open back up, the nerve works normally, and sensation returns.
And a common one is?
Oh, a very common one is lidocaine. You might even know that name because it's actually in some common throat lozenges for sore throats.
Wait, really? In cough drops?
Yeah, some of them. So there's little things. You pop for a sore throat, they're actually giving you a tiny dose of local anesthetic right there.
Huh. That's amazing. I had no idea my sore throat remedy was a mini anesthetic. Okay, so if we get local, then regional must kind of build on that, just bigger.
You've got it. If you understand local, you basically got the foundation for regional anesthesia. It blocks pain in a much larger area, but crucially, without putting the patient fully to sleep.
Okay.
Regional can use the exact same drugs as local, like lidocaine. The difference, the real magic, is how and where they're put into the body.
Ah, so placement is everything.
Yeah.
Like finding the right circuit breaker in the house's electrical panel.
Fantastic analogy, yes. For instance, the anesthetic might be injected near the spinal cord. That's like the main data highway carrying all the sensory signals up to the brain. If you block the pain signal there, you effectively numb a huge region of the body before those signals even have a chance to reach the brain. The epidural during childbirth is a perfect example of this kind of central block.
Okay.
Or let's say you're having surgery on just your arm or your leg. Another approach is to inject the anesthetic near one of the major peripheral nerves that specifically collects all the sensation from that limb.
Ah, so those nerves are like the wiring bundles for specific zones.
Exactly. The body's neural cabling, you could say. If we block the signals in one of those main bundles, the brain just stops getting information from that whole arm or leg.
Yeah.
It's super useful for surgeries on, say, a shoulder, an ankle, knee, wrist.
Gotcha. Okay. And then finally, the big one, general anesthesia, total loss of consciousness. How do they actually give that to someone? And what kind of drugs are we talking about for that universal off switch?
Right. If you've ever been put under for something, you'll know general anesthesia can be given in 2 main ways. Either intravenously, so injected into a vein, or by inhalation, where you breathe it in through a mask.
That's the classic count backwards from 10 moment, isn't it?
That's the one.
Okay.
Just take some deep breaths, count to 10, and you start 1, 2, 3, and usually you don't get much further.
Huh. Okay, so for the injected ones, what are the common ones? And I have to ask, the whole chloroform on a rag thing from old movies, does that actually work?
Hey, well, among the injected ones, probably the most famous today are Propofol and historically, thiopental was very common. For the inhaled ones, you have things like ether, nitrous oxide, laughing gas, or, yes, the very famous chloroform. But sorry to burst the movie magic bubble, it really doesn't work like that in real life. To get someone deeply anesthetized enough for surgery, meaning they're unconscious, their muscles are relaxed, they feel 0 pain, it takes much larger, precisely controlled doses than you could ever manage just soaking a rag.
Okay, good to know. No movie heists based on that then.
Okay.
So what's really changed, what's revolutionary about modern general anesthesia is that it's not usually just one drug doing everything, right?
You've absolutely hit on a key point. This is where something called balanced anesthesia comes in. It's really clever. Instead of using one massive dose of a single powerful drug like a blunt instrument, we use a sophisticated cocktail of different drugs. Each one targets a specific job, one for pain, one for unconsciousness, maybe another for muscle relaxation.
Ah, like a team approach.
Exactly. And often, this means we can use lower doses of each individual drug, which allows for incredible precision and usually minimizes side effects. It's really a testament to how refined the science has become.
That makes sense.
And while, each specific general anesthetic might have a slightly different way it works at the molecular level, they all ultimately aim for the same goal. Stop the brain from getting and processing pain signals and induce that controlled, reversible unconsciousness.
So they're basically blocking communication between neurons, but like way more intensely and brain-wide compared to local or regional. Can you give us an example? Like how does one of the big ones, say Propofol, actually achieve that massive disconnect?
Yeah, Propofol is a great example. It's probably the most common IV anesthetic now.
Right.
If you've had a colonoscopy or, surgery recently, chances are you got Propofol. It works really fast, causes rapid loss of consciousness, but it also does other interesting things in the brain. For example, it significantly dials down overall brain activity. It even makes the brain use less oxygen. It's like putting your brain into a temporary induced airplane mode.
Wow.
And a nice side effect that we don't fully understand why is that Propofol also seems to affect the brain areas controlling the vomiting reflex. So it often helps reduce that awful post-op nausea and vomiting.
That is a plus. So how does it do all that? How does it power down the brain so effectively?
Well, its effect is remarkably similar to a natural chemical in our brain called GABA.
GABA.
Yeah, GABA. Think of GABA as the brain's own natural break or calm down signal.
Right.
When your nervous system gets too excited or noisy, GABA steps in to slow things down, helping us relax, maybe even sleep.
Okay, the brain's chill out messenger.
Pretty much.
Yeah.
And what Propofol does very cleverly is it latches onto the same receptors, the same buttons in your brain that GABA uses. But it kind of holds those buttons down more firmly or for longer. It enhances GABA's effect.
Ah, so it boosts the natural calming system.
Exactly. It forces those neurons to power down more strongly. And when enough neurons across the brain shut down like that, we lose consciousness. That's why it's such an effective general anesthetic.
Okay, wow. So, yeah, each anesthetic has its own clever trick, but now we have a much better sense of how they all kind of conspire to turn us off. But knowing how they work is like half the equation.
Right.
The other really crucial part, especially if you're facing general anesthesia yourself, is understanding your role, preparing for it.
Yeah.
What are the absolute must-do things to ensure, not just comfort, but actual safety?
That's a really important point. Usually the hospital staff, the nurses, the doctors, they'll give you a whole list of instructions beforehand, specific to your operation. Might include things about medications you take, other recommendations. But there is one instruction that you will always get, and for a very, very good reason. You absolutely must fast. No food or water for typically about 6 hours or more before the surgery.
That's the tough one for a lot of people, isn't it? Why is that rule so incredibly strict? Like, why no coffee, no juice, not even a tiny sip of water? Seems harsh.
It seems harsh, but it's a critical safety measure. It's not pleasant to think about, but when you receive a general anesthetic, it doesn't just make you unconscious.
Right.
It also relaxes muscles all over your body, including the sphincter that's the muscular valve between your esophagus and your stomach.
Okay.
Normally, when you're awake, that valve stays tightly shut, keeps stomach contents down where they belong. But under anesthesia, that protective mechanism just stops working effectively.
Ah.
So if you haven't fasted, if your stomach has food or even liquid in it, there's nothing really stopping that stuff from coming back up your esophagus.
Oh, okay. I see where this is going.
Yeah. And the real danger isn't just reflux. Normally, if you vomit, there's a reflex involving a little flap called the epiglottis that covers your windpipe, directing the vomit out your mouth. But under general anesthesia, that reflex can fail too. So the vomit doesn't necessarily go out. It can tragically end up going down the wrong pipe into your lungs.
Oh, wow. That sounds really bad. What's that called? What happens then?
It's called bronchoaspiration. And it is genuinely one of the most serious, potentially grave complications of general anesthesia. When stomach contents, especially illicit ones, get into the lungs, they can cause severe damage. Things like chemical pneumonitis or aspiration pneumonia, these can be incredibly dangerous, even life-threatening.
Okay. Message received. Loud and clear.
So now you know. For general anesthesia, you always go in fasting. No coffee, no juice, not even water. Nothing. It truly, truly is for your own safety.
Right. That makes the fasting rule incredibly clear and, vital. But, okay, beyond preparation, let's talk big picture safety. Is anesthesia safe today? Like, genuinely safe? Or should we still have some level of worry?
That's the million-dollar question, isn't it? And the resounding answer, honestly, is yes. Modern anesthesia is exceptionally safe. It's one of the safest major medical procedures we have.
That's good to hear.
You have to remember, the people giving the anesthesia, the anesthesiologists, the nurse anesthetists, they aren't doing this for the first time. These are highly trained specialists, years of education, years of experience. They are meticulously monitoring every single vital sign, constantly adjusting the anesthetic cocktail specifically for you, for your body.
That is reassuring. But,
Yeah.
I mean, like anything in medicine, there have to be some risks, right? Even if they're rare. What are the main ones we should know about, besides the aspiration thing we just covered?
You're right. No medical intervention is completely zero risk. But the risks with anesthesia are very, very low these days. Bronchoaspiration, as we discussed, is probably the most significant potential complication, but following the fasting rules reduces that risk dramatically.
Okay.
Another rare possibility is an allergic reaction. Could be to the anesthetic drug itself, or maybe a preservative in it, or even things like latex, though most places are latex-free now. But again, this is why they have you fill out those incredibly detailed medical history forms beforehand. They ask all about allergies.
Right, those long forms.
Exactly.
Yeah.
They check everything thoroughly. Plus, there are personalized preoperative assessments. They look at your whole medical history, lab results, even talk about lifestyle factors. It's all geared towards creating the safest possible plan just for you.
And what about that fear? It seems pretty common. The fear of waking up, like during the operation, that sounds absolutely terrifying, like something from a horror film.
Yeah, that's a big fear for many people. And historically, maybe decades ago, it was slightly more of a concern because the monitoring wasn't quite as sophisticated. But today, it's incredibly different. Anesthesiologists have sophisticated monitors tracking your brain activity, your heart rate, blood pressure, oxygen levels, everything, constantly. They can see the depth of anesthesia in real time.
Oh, okay.
If they detect even the slightest hint that you might be becoming aware or feeling discomfort, they adjust the medication immediately. Waking up during surgery now is incredibly, incredibly rare, almost negligible.
That's a huge relief to hear.
Absolutely.
Yeah.
Now, what is completely normal is feeling a bit, out of it after you wake up properly. Disoriented, maybe confused, dizzy. Those funny videos of people saying weird things, that happens because it's totally normal. So if you've ever said something slightly embarrassing waking up, don't worry. You are definitely in very good company.
Huh. Good to know. So, okay, summing up the safety part. Modern anesthesia is remarkably safe. It's a precise science, and if you follow the instructions, especially fasting, it's even safer. We can basically relax about it.
That's exactly right, which I think brings us towards the end of this deep dive into the world of anesthesia.
Yeah.
And you can see, can't you, behind that really simple, common phrase people use, oh, I just fell asleep and knew nothing.
Yeah.
There's actually a huge amount of really complex, fascinating science going on.
Absolutely.
Understanding how our bodies sense pain, how our consciousness works or can be paused, and how these different anesthetics target those systems with such nuance. It really does highlight the incredible precision and the continuous innovation happening in medicine.
It really is astonishing when you stop and think about the intricate balance inside us. Consider how something as fundamental as pain, which is literally there to keep us alive, can be temporarily and safely just paused, switched off to allow healing to happen. What does that ability tell us about how far we've come in understanding and maybe even controlling our own biology? Maybe think about how knowing this stuff might empower you a bit more in your own health journey. Perhaps gives you a deeper appreciation for those quiet miracles of science happening in operating rooms every single day.
A great thought to end on.
Until next time, stay curious.